Coronavirus death numbers in context. And this short video uses statistics up to March 17th, 2020. And I'm going to take a look at how large the currently reported number of deaths from the coronavirus, COVID-19, is compared to what we might expect from just some vanilla disease that would be put in the influenza and pneumonia category by the CDC. So let's take a look at that context first. In other words, the flus and various mysterious diseases that hit people all the time. So these are statistics from the year 2017 from the Centers for Disease Control. And this is the category of influenza and pneumonia, which is actually the 8th leading cause of death in the United States. And in 2017, 55,672 people passed away from various diseases, viruses, bacteria, all sorts of things that get lumped into this category. So that's a bit over 1,000 people per week. This is the age distribution for this. Age is quite important in interpreting the statistics for this. So what you can see here is these numbers are broken down in 2017 by the age of the victims. So only 157 of the deaths, for example, were infants under the age of 1. You can see that children and people all the way up to maybe their 40s, deaths are very rare. In fact, almost half of the 55,672 people who passed away were over 85, according to the official statistics. So 24,276. 13,802 were in the range 75 to 84. 8,784 were in the range 65 to 74. And between 55 and 64 is about 5,045. And of course, 2,013 from 45 to 54. So the death statistics for influenza and pneumonia are dominated heavily by older people. And that mostly means people over the age of 50 or 55, depending on where you choose to draw the line. In general, when you look at mortality statistics, they're very low up until about the age of 50. We face a significant risk, several percent actually, for the general population of passing away in our 50s, even with all of modern technology. Influenza and pneumonia is a very broad category, and most of the viruses like coronavirus have been the subject of virus scares or outbreaks. If we didn't know what they were, if they weren't picked out and identified, if there weren't tests for them, if they weren't being hyped, they would just probably end up in this category. So one of the issues is, and the issue I'm looking at here is how significant are these deaths relative to what would happen every year due to the many diseases, mutated flus, mutated diseases, new diseases that are coming and going and getting grouped into this category. This is a sort of informal, unofficial statistics from Charles Atkinson, a reporter that's been putting out counts every day for the last week or so. And these are U.S. coronavirus deaths by state. They're mostly in Washington. I'll say more about that in a minute. And they're mostly over the age of 50. She's giving a total of 105 deaths total. I wanted to review as much as we could find from other sources and official statistics. This is the State of Washington Public Health website. So this is where most of the deaths have occurred so far. So you can see one county, King County, has 43 deaths. That's the Life Care Center nursing home is located there, where the first deaths and a substantial number of deaths have occurred. So their total is 52. It's a little bit lower than hers. It's hard to go through all these statistics. There are many different reports, many different agencies involved. So one should probably take them with a slight grain of salt. And keep in mind, without tests, without more in-depth information, these would normally just be classified as pneumonia and influenza deaths and probably completely ignored without this attention focused on this specific disease. This is the Centers for Disease Control. These are numbers. They say that the website is updated on March 17th, 2020. They don't say exactly what that means. And they're reporting total deaths of 75 deaths. Keep in mind, when they say cases, they don't mean deaths. Those are just people who've been diagnosed in some way and are said to have this disease. The testing is very new, so it's not necessarily that reliable, and the testing will tend to be done on people who are sick and people who have various fears or concerns or perhaps have come in contact with people that are thought to have had the coronavirus. So the testing is very at a very early stage, and it's hard to interpret that. But deaths are deaths, so let's look at the total deaths. So again, the CDC is saying 75. Charles Atkinson is saying 105. A lot of news reports this morning, it's March 18th, are saying over 100 now, which sounds bad, but the U.S. has 330 million people, and something in the range of over 1,000 people pass away each week from essentially very similar diseases. Okay, I wanted to try to say, well, see, where is this coming from? Okay, so this is the Life Care Center in Kirkland, Washington. This is a report from Business Insider, but there's a lot of reports out about this. So a lot of people there passed away and been diagnosed as having COVID-19. It's not clear exactly when the first death occurred. Looks like the first diagnosis was probably around the 19th. There are reports that the first death was reported about February 29th, so a little over 2 weeks ago. What does this mean? Well, currently there are 75 to 105 deaths attributed to coronavirus since about February 29th, 2020, so that's about 2.5 weeks. We would expect every year at least 1,000 deaths per week from influenza and pneumonia. Again, if we had no tests, there was no hype, there was nothing, the coronavirus would be lumped in with many other diseases, many other bacteria, many other viruses in these influenza and pneumonia deaths, which are highly concentrated among the elderly. So we would expect about 2,500 deaths to occur from all of these diseases in this category from February 29th, 2020 to March 17th, 2020. There's a statistical variation. This is like flipping a coin. So if I flip a coin 10 times, I expect on average to see about 5 heads and 5 tails, but it can fluctuate. So often I'll see 4 heads and 6 tails. And even by random chance, I'll sometimes see, although it's very unlikely, sometimes I would even see 10 tails or 10 heads. Similarly, the number of deaths is going to fluctuate from day to day. It's not a precise, steady rate, and it's going to fluctuate by about 50 deaths over a period of 2 weeks. So what that means is the 75 to 105 deaths are pretty much within the natural fluctuation range of the deaths anyway. So we don't have a clear spike in our rate of deaths from things classified as influenza and pneumonia yet. It's just too small statistics to tell if COVID-19 is unusually deadly. So the concern that we have is that unlike many of the pneumonias and influenzas and so forth that go around, this disease is more deadly, kills more people, and kills younger people at rates much higher than we normally see. And as I showed in the statistics, it's very rare for people under 50 to die from these types of diseases. It does happen, and sometimes unexplained why it happens. So many of those deaths will be people under the age of 50 who have some other kind of health issue or pre-existing health problem, are sick from something else, may have a weakened immune system due to various factors such as malnutrition or, for example, transplants of organs involve suppressing the immune system, other causes that may contribute. So the bottom line is we don't have enough death numbers yet to see and tell if this organism is in fact any more dangerous than the flus and common colds and other things that kill over 1,000 people per year in the United States. So that concludes the main point of this. I have a disclaimer here. I'm not a medical doctor. I'm not a medical professional of any kind. So if you have actual medical concerns, you're feeling sick, whatever, you should seek the professional, qualified medical advice, probably from a medical doctor or someone otherwise qualified. Nothing in this video is intended to supersede guidance from public health authorities or, again, qualified medical professionals. And I have more details here in the text if you want to read it. I also have a credit here for the coronavirus image, which is a free image from Pete Linforth. It's available on Pixabay, so I included a text link, and I also included a QR code. You can scan the QR code with your smartphone and get the link without having to try to type in this really long text link, and you can proceed to open it and take a look at his work and so forth. That concludes this video, which was produced on March 18th, 2020. If you like this video, please take a moment to click like. Please click subscribe and the notification bell if you would like to receive more content from us. We welcome constructive feedback and comments. Mathematical software is developing products and services to automate data analysis, reducing the risks of costly errors and improving results. If you want to support our work, you can subscribe on our Patreon page. This is the URL for our Patreon page. Scan the QR code in the lower right corner with your smartphone to get the Patreon link. Our Patreon link is also in the show notes below.